I will now invite Ms. Madhu Mitra, consultant ophthalmologist, to introduce our next speaker, Anthony Omo, General Counsel and Director, Fitness to Practice at the General Medical Council, who will discuss issues around COVID and our fitness to practice. Madhu.
It is my great pleasure to introduce Mr. Anthony Omo, General Counsel and Director, Fitness to Practice at the General Medical Council. Having joined the GMC in 2003, he became the legal advisor and the assistant director responsible for the legal services team in 2008. During this time, he developed and expanded GMC's in-house legal services. In 2011, he took on the extra role of the Assistant Director of Employer Liaison Services, which led to the successful rollout of the service across the UK. In 2013, he became Director of the Fitness to Practice, and in 2015, he was appointed as the General Counsel. Mr. Omo is the lead for delivering GMC's statutory function to ensure the doctors are fit to practice. Mr. Omo is also the senior sponsor and senior management team champion for GMC's BME network. He leads the GMC's program to implement the recommendations from Fair to Refer and Caring for Doctors, Caring for Patients reports. Friends and colleagues, let's welcome Mr. Anthony Omo.
Thank you very much, Prin Haldar, and I'm grateful for the opportunity to speak with you today. It's been so good to hear and be here at the Bapio conference and hear the focus on BME groups and the challenges faced, but also, very importantly, the various initiatives that will help tackle the very many issues we all face. I hope to add the GMC's voice to the solutions and to speak a bit about what we are doing. So as we all know, we're approaching a year since the UK was first locked down to manage the impact of coronavirus. We've all seen, and for some, very sadly experienced the tragic impact of the virus, driven home by this week's grim milestones. Coronavirus has put the whole of the NHS under unprecedented strain, but the impact on BME healthcare staff and patients has been especially acute. This is seen most vividly in the disproportionate tragic deaths of BME healthcare workers. We've long known that BME doctors and indeed other BME healthcare workers and patients all too often have a very different experience of the NHS throughout the UK. What has changed is the sense of urgency created by the events of 2020. And across the system, and you've heard from a variety of distinguished speakers this morning, there is a real collective will to tackle these issues, moving beyond words to meaningful action. And we at the GMC are committed to playing our part in that. So what are some of the issues that we have identified BME doctors face? Well, we know that the context in which doctors and other healthcare professions work is material to the care that they provide. Open, inclusive environments lead to better outcomes for patients. Toxic, stressful environments can cause risks to patient safety. Over the last few years, we've looked in detail at these issues. In 2018, we commissioned research into the disproportionality in our fitness to practice processes. It showed that BME doctors are twice as likely to be referred to the GMC by their employer as their non-BME counterparts. And because employer referrals are much more likely to lead to investigation, this imbalance drives very significant disproportionality into our fitness to practice caseload. Now, the reasons for this disparity are multifaceted and interlinked. They include, but are not limited to, a lack of timely feedback, inadequate induction, and the presence of blame cultures, which create particular risks for doctors who are seen as outsiders. Not being part of the in-group means not benefiting from the protective factors like mentoring and feedback. Another long-standing issue, and Push mentioned this just now, is the attainment gap faced by BME doctors. Exam pass rates reflect a 12% point difference between white and BME UK graduated trainees, rising to around 30% for overseas graduates. This gap exists and persists through undergraduate and postgraduate training and beyond into recruitment. Again, the reasons for this are subtle but pernicious. Relationships with peers and seniors are crucial as a doctor progresses through their career. But BME doctors report receiving less support and feedback during training and experience more barriers. No wonder then that Foundation Year 1 BME doctors are less likely to report feeling prepared for their first post than white colleagues. We've seen some of these dynamics play out during the pandemic. While 68% of white doctors said there had been a positive impact on teamwork between doctors, this figure dropped to 55% for BME doctors. So what are we doing? Well, a number of things. We know that in Wales, the NHS is reliant on a very large proportion of internationally qualified doctors. In Hywel Dda Health Board, for example, just over 40% of doctors on our register are internationally qualified. We also know that internationally qualified doctors are much more likely to be complained about in their first years of practice in the UK. So we've developed and massively ramped up free induction training for overseas doctors to support the transition to UK practice. Before the pandemic, back in early 2020, 40 doctors attended 5 sessions in locations in Wales. And since the lockdown, we've held these sessions virtually across the UK, reaching over 1,800 doctors. We've also built human factors training, that is the impact of systems on performance, into our processes. This ensures that the context in which doctors work is properly considered in investigations. And we're not complacent about the potential for our own processes to be discriminatory. So we conduct regular internal and external audits to ensure they are free from bias. But it is clear that there is much, much more work to be done. We need to move faster, be more ambitious, and more collaborative. Past experience tells us that what gets measured gets done. We know that not everything that is important can be measured, but to hold ourselves and others to account, we need to be able to meaningfully track progress. That's why we're developing targets around differential attainment and referrals from employers, 2 persistent areas of disproportionality. We are returning to our council next month to seek final endorsement on the detail of these measures, but we have already agreed that they will be stretching. Now, colleagues, you've heard this from all the speakers. No one organization or system can solve the problem because no one organization controls all the levers, and the GMC is no different. We do not control all of the levers. The issues BME doctors, other healthcare workers, and patients face are systemic, and the response must be system-wide too. So collaboration is central to our approach. One example is our support for NHS England's Medical Workforce Race Equality Standard, a new set of measures to track fairness in medicine. This data will allow us to see things like the likelihood of BME applicants being appointed for consultant posts compared to BME and white applicants. We stand ready to use our data to help support any work that may be planned for in Wales, and we are talking to a number of partners around this. And we're working with the Medical Schools Council to make the curriculum more diverse, so students learn to identify how conditions appear on different skin tones, for example. In Wales, twice a year, we formally consult our partners through our UK Advisory Forum. Members include the Welsh Government, medical leaders, medical education bodies, system and professional regulators, and patient representative organisations. The forum allows us to focus on long-term priorities and seek views on policy development. At our last meeting in October 2020, held in virtual form, we heard about the challenges of recovering services while the pandemic continues. We invited Keshav, who is a member of the forum, to speak about the COVID toolkit and its rollout across not only the NHS, but the wider public sector. Members highlighted remarkable achievements, including ongoing innovation across healthcare, support for staff from BME communities, increased collaboration and regulatory alignment. All very good things. But we all now have an opportunity to make inclusive, supportive environments the lived reality for every doctor, to enable them provide safe care. So our plea is from regulators to employers, royal colleges to government. We all have a role in promoting long-lasting change. We must use the good things that have come from working through the pandemic to create long-lasting change. This is critical not only for BME doctors, but also the patients they serve. Thank you very much for listening and having me today.
Thank you, Mr. Omo, for explaining why BME doctors are more likely to be referred to the GMC. It is heartening to hear that the GMC is taking these issues seriously and are trying to resolve the problem. Thanks again. I will now invite Dr. Sridhar Kamath, consultant radiologist, to introduce our next speaker, Right Honorable Alun Cairns MP, who will discuss immigration issues related to the global workforce.
It's my great pleasure to introduce the Right Honorable Alun Cairns MP. Alun is a Conservative Party Member of Parliament continuously since May 2010, who has been elected 4 times from the constituency of the Vale of Glamorgan. Alun is a former Secretary of State for Wales and a former Government Whip, Lord Commissioner of Her Majesty's Treasury. Alun was elected as an Assembly member to the Welsh Assembly in 1999. He's passionate about Welsh community, always playing a part to help change it for the better. Alun is very actively involved in the UK government's efforts to control and manage coronavirus pandemic and provides crucial coronavirus advice and support information. The Right Honorable Alun Cairns MP.
Well, thank you very much, Sridhar. It's hang on, let me just. Thank you very much, Sridhar. It's a privilege to have the opportunity to speak once again to the Bapio Wales conference. I was trying to count back of how many I've been to, and it's such a good thing that I'd lost count, which is such a privilege. Because I've enjoyed attending so many of them. I think I've attended all of them since 2010, and while I was an Assembly member, I can remember attending them as well. And it's at each one we highlight the contribution and the benefits that that you all make to the NHS across the UK and specifically in Wales. And I think the joke that I've probably used several times at your dinner event is if there's ever a place I want to go ill, that's the place I want to be, because every skill and every medical and clinician background is in the room at that time. But I've learned so much from being associated with the conferences. I want to say, before I go on to that, I want to pay tribute to Keshav Singhal and to Haz Shah as clinicians for the role that they play as chairman and as secretary of Bapio. I think organising a conference at any time is a difficult task, but I think organising a conference during a global pandemic takes it to an absolute and paralleled level. So I pay tribute to them specifically, but it's dangerous when you start naming people because I could start highlighting so many others as well. I mean, it's important to highlight Mrs. Singhal, of course, and Mrs. Shah as well for their work. Because behind every great profession, there's a partner in support as well, or behind every great professional, there's a partner in support as well. So I'm going to leave my recognitions at that level. Please forgive me if you feel I should have named you, but I'm sorry that there would be so many of you that it would be difficult to do. But as I was saying, having had the privilege of attending so many of your the seminar sessions, as well as the fantastic dinner and celebration that you have in the evening, I've come to know so many of you, and it's been a privilege to have some to my office on work experience as a result, because I know that family is so important to you as it is to me. But I've learned so much professionally. And I've highlighted and championed this with some parliamentary and assembly colleagues. I think in one of the early ones, I saw a presentation from Keshav about the efficiency he introduced into orthopaedic care to ensure that that the delay in discharge was reduced to make the treatment so much more efficient, which is now a standard that has been spread and adopted in so many other places. I can remember one of your fellow professionals from Moorfields Hospital giving a briefing on ophthalmology and some of the pioneering global research that was being done there, but also been supported by some of you as individual professionals here. So it's absolutely remarkable to get a better understanding, and a privilege for me as not a clinician to try and understand more about the challenges and what you see as opportunities. And I should say, maybe tongue-in-cheek, some of the challenges you have against governing, and I mean the government as part of that, and the regulatory bodies, maybe not always freeing you up to do what you would like to do as clinicians, making it something of a challenge. And then I touched on briefly the cultural exchange, which it really is. This serves as such an important cultural exchange, and I've talked about the dinner already, and the dancing that takes place, and that is from your family members, who are, many of them are professionals or are studying for the highest level of qualifications themselves, and that underlines to me the work ethic that the Indian community or that people with Indian origin bring to the UK, but specifically to the National Health Service and to medicine in general. And I must say, following some of the last talks that have taken place on your agenda this morning, Keshav's work with others that will be on the conference as well about risk assessment tool with COVID-19. I think that has really been pioneering work, which demonstrates the proactivity that you take. So, and I've said all of that without even talking or mentioning COVID-19. And if there is ever a year that we have needed all of that experience, all of that skill, all of that commitment to the profession, but more importantly, I would say to patients, this is a year that we have needed it. And as I touched on earlier, organizing a conference during a global pandemic, it takes us to that next level, because even with the pressures that you are under, I can see many of you, your hair is a bit longer than normal, I should say. those of you who have it. And I would say that you're all looking a little bit more tired too. And I mean that in the best possible way, because of the exhaustion that will have taken place throughout the last close to 12 months, 10 months or so. So that's the context in which I want to contribute and thank and extend my appreciation. And I think the government then, I talked about the governing bodies and the government itself, we have a major role in supporting you, because we should be enablers rather than the directors. You are the ones who know your theatre, you are the ones that know the stage, and we have a responsibility in providing you with all of the tools that you need and providing you with all of the freedom and guidance that you need. And I touched on the governing bodies, and sometimes governments can play a positive role in challenging those to give you that freedom, because politics extends well beyond party politics and governments and the political parties. I know politics can extend throughout the whole host of organisations for good reason, and that isn't certainly not a criticism. But in supporting you, the UK's stage in the world is extremely important, because you want to be able to attract the best clinicians, the best staff, the best research to the UK. And if we are a nation that is rolling up the drawbridge for international skills, for international investment and research, then clearly we won't be able to retain you as individuals and your skills either. So when we left the European Union, it was a determination, and it was a privilege to play a part in the UK cabinet in this. In that, although I voted to remain in the European Union, I absolutely accepted the outcome of the referendum immediately the day that it was announced that we were to leave. And my statement to 3 prime ministers, and that was to David Cameron, to Theresa May, and to Boris Johnson. I had the privilege of serving with all 3 prime ministers in the cabinet, that the UK must be global leaders in free trade, but I mean trade in the broadest possible sense, and that means includes movement of people. I'm not one who has prioritized the debate around immigration in the same way that others have. I recognize immigration needs to be managed, but I see immigration as a major positive influence on society and community across the UK. And in the medical profession, I think, and in the highest level of skills, immigration is essential and something that we need to be encouraging in the right fields. And earlier this year, the immigration process will have changed, of course, because we will have formally the implementation period of leaving the European Union will have ended. And at the turnover of the new year, and the points-based system was introduced. Now, as global leaders in free trade, I'll touch on the points-based system in a moment, but as global leaders in free trade, or in global leaders in so many professions, we want to be nimble, responsible, and a principled nation. And that's what the point-based system will allow us to be. When there was free movement, immigration is naturally a debate that has been across the whole of the UK for some time, and maybe something that wasn't taken seriously by all politicians in the early stages. So it then became something more of a challenge. And as the free movement formally from Europe became ever greater, maybe than some people predicted, it then left us in a position whereby we sometimes had to close our borders to people that might otherwise have come to the UK, simply because to manage the total numbers. Well, our point-based system, I think, plays purposely into the hands of professions such as yourselves, and that means that we don't have to restrict the numbers from outside of the European Union because of the free movement from the European Union that we had until the end of last year. And the current points-based system is relatively simple in its process. There are 3 criteria that are mandatory that we would expect everyone to hold, and they're not, I believe, unreasonable. And I think that in the medical profession, they would be essential in order to have the right to practice. One would be a job offer from an approved employer. The second is a job at an appropriate level of skill, and the third is the ability to be able to speak English. Those 3 are mandatory. And then the rest of the points-based system is made up of a whole host of criteria relating to the salaries of jobs, relating to the shortage of occupations, relating to the education qualifications, and so on. And that then will come together in allowing and encouraging people, the brightest and the best from around the world, to come here. So 3 mandatory, and then additional points that are gained for different salary levels and different forms of occupation. But of course, the health and care visa is something that is particularly special and something that is really important. And when I mentioned earlier the nimble, responsible, principled approach that we need to be taking to our international outlook, well, I think that when COVID broke, we recognized that the fees associated with the healthcare visa was absolutely wrong, was unsustainable, and thankfully that was changed at quite short notice. And that's the nimble process by which I think that the government will want to continue to bed in and refine and develop the points-based system. And we are always or the government is always in listening mode on how we can continue to improve it. But what I would then add to that is that, of course, in 2 of the 4 great offices of state, we have Rishi Sunak and Priti Patel, who have great Indian heritage, who recognize the special relationship that we have with the subcontinent, and their influence is quite remarkable, of course, of being the most senior government offices. I would say that Rishi's brother is a psychologist, and Rishi's sister is the United Nations lead at the Foreign Office on COVID-19. So I'm confident that their ears are being bent regularly from both, Rishi is from both his brother and sister. And I also know that, well, many of you will have met Priti Patel when she came to the Wales India Centre, and her passion for deepening the relationship between India and the United Kingdom is something that that was obviously evident when she visited at that time. So with that, I want to, I'm within the limited time, I want to once again say thank you so much for what you are all doing. Thank you for what you have done throughout the last year in particular. It is absolutely remarkable. It will be recognized. It will be recorded in history for the contributions in the same way that so many of our veterans are recorded for so many of their contributions in international conflicts. But this has been a global conflict that you have been at the forefront of. You have been conducting those risk assessments. You have been treating some of the sickest patients. You have been involved in some of the most world-leading research. And I will always recognize that we are the supporters for you in the professions to be able to deliver that. And you need to be reminding any politician of any political persuasion of what you need, what you want, what you demand in order to make your lives and your jobs easier. And in following the theme of what I talked about, the people that you need as well. And if our immigration system isn't supportive to you and to your families, then it isn't working. I hope it is. It's still bedding in. There's more to do, but we want to be that, as I mentioned earlier, that nimble, responsive, principled nation. And I think the news over the last couple of days has shown what we as a nation can achieve, maybe as a smaller nation compared to some of the other global blocks or players. But I think that the way in which vaccinations are tested, I think the way in which the vaccinations are being rolled out, once again, pay tribute to you. So thank you very much. It's been a privilege to have the right and opportunity to contribute to your day, and I wish you well in the rest of your conference. Thank you.
Thank you, Mr. Cairns, for outlining the new points-based system for global immigration. Bapio recognizes the political challenges that are posed by immigration, but are glad that the government is taking the issue seriously and trying to improve matters for both sides.